1. U.S. bird flu emergency response ends. What you need to know. 2. CDC ends H5N1 bird flu emergency in 2025. No human cases in months explained. 3. CDC ends emergency response to H5N1 bird flu. What you need to know. 4. CDC ends emergency bird flu response. What you need to know. 1. U.S. bird flu emergency response ends. What you need to know. Imagine a world where a deadly virus spreads like wildfire, infecting not just humans, but also animals, and causing widespread economic disruption. This is the stark reality of the bird flu outbreak that has been ravaging the United States, sickening dozens of people, spreading to cattle, and driving up egg prices. But here's the good news: the U.S. Centers for Disease Control and Prevention, CDC, has finally ended its emergency response to the crisis, signaling that the outbreak has begun to subside. But how did we get here, and what does this mean for the future of public health in America? Let's take a closer look. The CDC's emergency response to the bird flu outbreak was a necessary measure to contain the spread of the virus and prevent further human cases. The agency worked tirelessly to track the spread of the disease, identify areas of high risk, and implement measures to reduce the risk of transmission. And it seems that their efforts have paid off, with the number of new cases declining significantly in recent weeks. But the impact of the outbreak has been far-reaching, with egg prices soaring and cattle farmers struggling to contain the spread of the disease. So, what can we learn from this experience, and how can we better prepare for future outbreaks? One key takeaway is the importance of swift and decisive action in the face of a public health crisis. The CDC's rapid response to the outbreak helped to prevent a much larger disaster, and their efforts should be commended. But we must also recognize that there is still much work to be done to prevent future outbreaks, and to support those who have been affected by this crisis. And this is the part that most people miss: the bird flu outbreak is not just a public health issue, but also an economic one. The impact on the agricultural industry has been significant, with many farmers struggling to stay afloat. So, what can be done to support these farmers, and to prevent similar economic disruptions in the future? The answer is not simple, but it's clear that we need to take a more holistic approach to public health, one that takes into account not just the human impact, but also the economic and environmental consequences of an outbreak. But here's where it gets controversial. Some argue that the CDC's response to the outbreak was too slow, and that more could have been done to prevent the spread of the disease. Others argue that the agency's efforts were sufficient, and that the outbreak was inevitable. So, we want to hear from you. Do you think the CDC did enough to respond to the bird flu outbreak, or could more have been done? Share your thoughts in the comments below. In conclusion, the end of the CDC's emergency response to the bird flu outbreak is a welcome relief, but it's also a reminder that there is still much work to be done to prevent future public health crises. By learning from this experience, and taking a more holistic approach to public health, we can work towards a future where outbreaks like this are a rarity, rather than a reality. And that's a future worth fighting for. 2. CDC ends H5N1 bird flu emergency in 2025. No human cases in months explained. The U.S. Centers for Disease Control and Prevention, CDC, has officially ended its emergency response to the H5N1 bird flu, marking a significant turning point driven by a notable decline in reported cases. But here's where it gets controversial. Does this decision fully reflect the reality on the ground, or is it a pragmatic easing of vigilance? In an official statement released on July 2, 2025, a spokesperson from the U.S. Department of Health and Human Services explained that as infections in animals caused by the avian influenza A, H5N1, virus have decreased and no human cases have been documented since February 2025, the CDC transitioned from an emergency footing back to routine program operations. This means while the high alert emergency phase has been deactivated, ongoing monitoring, preparedness, and response strategies for all influenza viruses, including H5N1, remain firmly in place within the CDC's Influenza Division and other relevant federal agencies. Dr. Nirav Shah, who stepped down earlier this year as CDC's Principal Deputy Director and is now a visiting professor at Colby College in Maine, affirmed that he supports the decision to end the emergency response. He highlighted that this move wasn't a top-down mandate but rather a decision made by CDC's career scientists based on the current data. Simply put, with no recent human infections, there's no need to maintain an all-out daily sprint. If new human cases emerge, the response can be quickly intensified, literally within an afternoon, Shah said. This perspective encourages confidence in the CDC's ability to scale efforts up or down as situations evolve. The initial declaration of the H5N1 emergency occurred on April 4, 2024, enabling enhanced resources such as increased staffing for more efficient public health actions. Since then, the CDC and partners have monitored the virus closely. Bloomberg News first reported the end of this emergency phase earlier this week. To understand the bigger picture, it's important to recall that H5N1 was first identified in the late 1990s and has caused intermittent outbreaks worldwide since then. In the US alone, since 2022, this virus has impacted nearly 175 million birds, including wild species, commercial poultry farms, and backyard flocks, indicating widespread agricultural and ecological effects. Moreover, the virus has spilled over into dozens of mammal species across more than 100 countries, highlighting its broad host range and global reach. A particularly alarming development occurred in early 2024, when H5N1 infected dairy cattle within the United States, posing a new and serious threat to the dairy industry. Over the past 14 months, the virus has spread to upwards of 1,000 herds in 17 states, raising questions about ongoing animal health management. Regarding human health, there have been 70 confirmed cases of H5N1 infection in the US to date, with one reported death. While these numbers are relatively low, they underscore the virus's potential for zoonotic transmission and the need for vigilant surveillance. Experts caution that bird flu tends to show seasonality, often surging in the fall or early winter, which means we might yet see case numbers fluctuate. Furthermore, changes within federal health agencies could mean some milder cases go undetected, although severe cases are unlikely to be missed. The CDC has made it clear that despite stepping down from the emergency posture, they remain ready to ramp up monitoring and response activities swiftly if necessary. So here's the question that might spark debate: is ending the emergency response a sign that H5N1 is truly under control, or could it lead to complacency just when vigilance is most needed? What do you think? Are federal agencies striking the right balance between caution and practical resource management? Share your thoughts and let's discuss. 3. CDC ends emergency response to H5N1 bird flu, what you need to know. In a major shift, the CDC has officially closed its emergency response to the H5N1 avian flu, signaling a potential turning point in the ongoing bird flu saga. But here's where it gets controversial. While the agency cites declining animal infections and no human cases since February, critics argue the virus's long-term risks remain underappreciated. A spokesperson for the Department of Health and Human Services, HHS, confirmed the emergency response was deactivated last week to return to regular program activity, emphasizing that surveillance and preparedness efforts will continue under the CDC's Influenza Division. This decision follows a year-long emergency phase, which began in April 2024 after the virus sparked a surge in animal outbreaks and 70 confirmed human cases, including a tragic fatality in Louisiana. The deceased individual, a man who likely contracted the virus from his backyard poultry, highlights the rare but real threat of direct bird-to-human transmission. And this is the part most people miss: despite the CDC's optimism, the absence of human-to-human spread doesn't eliminate all concerns. Viruses like H5N1 are notorious for evolving, and even a minor mutation could change the game entirely. The agency admits the current risk is low but vows to scale up activities as needed, a phrase that leaves room for interpretation. Over a dozen U.S. states have reported H5N1 cases, with the West Coast, particularly Washington and California, bearing the brunt. Yet the focus on these regions raises questions: are other areas being monitored adequately, or is the response still too narrow? As the CDC shifts gears, the public is left wondering, should we celebrate this progress, or brace for a potential comeback? Share your thoughts. Do you think the agency's decision is premature, or is it a justified step given the data so far? 4. CDC ends emergency bird flu response, what you need to know. **** The CDC's decision to conclude emergency bird flu measures, a shift in public health strategy. In a significant development, the U.S. Centers for Disease Control and Prevention, CDC, announced on July 7, 2025, that it has officially terminated its emergency response to the H5N1 bird flu outbreak. This decision comes in light of a notable decrease in animal infections and the absence of any reported human cases since February. The emergency measures were deactivated on July 2, as confirmed by the agency, which emphasized that ongoing surveillance and response efforts for bird flu will now fall under the jurisdiction of its influenza division. This transition marks a pivotal moment in the CDC's approach to managing avian influenza, blending updates on bird flu with regular seasonal influenza reports, as indicated on the agency's website. Moving forward, the CDC will provide monthly updates on the number of individuals being monitored and tested for bird flu. However, it will no longer publish infection rates among animals on its website. Over the past year, the H5N1 virus has infected 70 individuals, primarily farm workers, and has resulted in one fatality as it spread aggressively through livestock and poultry populations. But here's where it gets controversial. Experts have raised alarms about the potential for further spread of bird flu, warning that it could increase the likelihood of the virus becoming more easily transmissible to humans. Despite these concerns, the CDC has stated that the current public health risk associated with H5N1 remains low. The agency reassured the public that it will continue to monitor the situation closely and will ramp up its activities as necessary. This year, the nation's response to bird flu has encountered several challenges, including a significant staff exodus at the U.S. Department of Agriculture, which was part of broader efforts by the Trump administration to reduce the federal workforce. Additionally, the government canceled a substantial contract worth over $700 million with Moderna for the late-stage development of a human vaccine against bird flu. Bloomberg News was the first to report the CDC's conclusion of its emergency response to bird flu. The activation of emergency measures is crucial as it allows for enhanced public health support, including increased staffing and resources to bolster testing, surveillance, and communication during outbreaks. The CDC's response to the H5N1 bird flu was initially activated on April 4, 2024. As we reflect on this development, it raises important questions. Are we truly prepared for the next potential outbreak? What measures should be prioritized to ensure public safety? We invite you to share your thoughts and opinions in the comments below.